Hi everyone, I hope you guys are keeping well. Today I'm going to talk about spinal stenosis. I've received many questions through my YouTube channel from you guys that you've been asking me about spinal stenosis and what are the options for rehabilitation and treatment. In this video, I've prepared a series of exercises and also I'm going to show you what is the cause of spinal stenosis is, what are the signs and symptoms and what you should do about it. At the same time, I'm going to share with you 3 important tips at the end of this video that I would suggest you to follow and watch this video until the end. Now, if you find that you have any question beside what I've shown you in this video, please leave me a comment underneath of this video and I would be happy to create more video for you in the future. Let's get started. If you've never been in this channel, my name is Bob, I'm a physical therapist and the purpose of this channel is to help people like yourself with simple tips and exercise for quicker recovery. Make sure to subscribe my channel for my weekly update and press that like button.
Spinal stenosis is the narrowing of the space within your spine, which can put pressure on the nerve that travel through the spine. Spinal stenosis happen most often in the lower back and the neck. Some people with spinal stenosis may not have any symptoms and others may experience pain, tingling, numbness and muscle weakness. The most common cause of spinal stenosis is aging and wear and tear changes in the spine. I'm going to share with you other common causes of spinal stenosis.
The common causes of spinal stenosis can be spinal osteoarthritis, degenerative disc diseases, or ligament thickening or bulking. Spinal osteoarthritis happens when the smooth cartilage covering the facet joint starts to break down. Bones begins to rub against each other and may lead to formation of abnormal bone growth called osteophytes or bone spurs. The resulting inflammation and osteophytes formation can contribute to narrowing of the foramina. Degenerative disc diseases happen when the disc lose hydration and start to flatten. The intervertebral foramina also start to narrow. A disc bulge can also start to push into the spinal canal. Disc degeneration can also put more pressure on the facet joint and accelerate their degeneration as well. The symptoms of lumbar spinal stenosis is divided to decreased endurance during physical exercise and activity, weakness or loss of balance, numbness and a pricky feeling in your legs, calves or buttocks. You may experience aching or dull back pain radiating to your legs. These symptoms may improve when you sit down or lean forward or lie on your back or sit with your feet raised. You may experience neurogenic claudication. If you're experiencing any of these symptoms, you may visit your physical therapist for correct diagnosis.
The treatment option for spinal stenosis divided to physical therapy and strengthening exercises, rest and restriction of physical activity that bothers you, injection to reduce the pain and swelling, medication and analgesic to reduce pain and swelling.
Alright guys, one of the other questions that many of you guys have been asking me through my YouTube channel is that if I have a lumbar spinal stenosis, do I need surgery or not? I would like to share with you a couple of studies and research that look at whether surgery would be better than rehabilitation exercises or not. Let's get into it. When we're looking at basically a study that has done in 2018, which is a systematic review and meta-analysis of basically checking exercise therapy versus surgery for lumbar spinal stenosis. They have had 897 patients that they were divided in 2 groups and literally looking at which groups can have a better results, and they have concluded that the current evidence demonstrated a trend that exercise therapy had a similar effect for lumbar spinal stenosis compared with decompressive laminectomies. However, they highlighted the sample size of their study. Even though there were 897 patients, they were still included that the sample size were small and they would like to have a bigger sample to be able to create the confirmed conclusion of that surgery and basically rehabilitation can be pretty much similar. But when you're looking at the result of this study, both groups had got a similar basically effect out of whether surgery or doing just only rehabilitation exercise and physical therapy. Now, when we're looking at another study that they've looked at surgery versus non-surgical treatment for lumbar spinal stenosis, and they had a comparative effectiveness randomized trial with 2 years follow-up. When we're looking at that, they find a similar results, even though they had a smaller group basically, and they compared this treatment and surgery between 169 patients, and they divide them in two groups. And what they have concluded here, participants in both groups saw benefit in early as 10 weeks after surgery or beginning physical therapy, and their lower back pain continued to decline over 4 months, while their physical function continued to improve as well. After 2 years later, there was no differences in pain or function, physical function between the surgery and physical therapy groups. And as you can see, like literally, this is something that actually is not basically a conclusion that surgery is a no, but it can give you a brief idea whether do you need necessarily to do the surgery or not, and or does exercise therapy and physical therapy can be enough and good enough for you. Now, I hope this information can help you to make up your mind and see what would be the best things for you, and be discussing that with your physical therapy or orthopedic surgeon. Probably they can give you a better idea. But at the same time, in this video, I prepare for you a simple rehab plan that you can do at home that can help you with pain and mobility. Let's get started.
Alright guys, we're gonna start this routine with hip stretch. That we're gonna start with a single leg modification. You're gonna lie down on your back and hold the knee in a basically comfortable position that you can feel the stretch for within 15 to 20 seconds. You can try this exercise for both sides, and you're gonna work around your own range, which means avoid overstretching the knee. If you find holding on the knee at the top of the knee is uncomfortable, you can create a modification and hold the knee from underneath of your leg. Whenever you felt comfortable, you can progress this exercise to double leg hip stretch and hold it for 15 to 20 seconds for 3 to 4 rounds. The next stretch that I'm going to show you guys is going to be figure 4 stretch, which is a great stretch for hip mobility, and you can do this stretch in a seated position or in the position that I show you in this video. If you find sitting on the ground is difficult, you can do the same thing on the chair. You want to try this exercise in both sides and apply a slight pressure with your hands on the knee for maximizing the stretch. You can hold it for 10 to 15 seconds in both sides for 3 to 4 rounds in a daily basis. We're going to move on to clamshell exercise, which is a strengthening exercise for your hip muscle. This exercise can be done in a sideline position, and you basically abduct your hip, and that activates your gluteus medius muscles. If you're suffering from spinal stenosis, you can try this exercise to strengthening your hip. And what study has shown, if you have a stronger hip, you put less pressure on your lower back. You're going to try this exercise for 3 sets of 8 to 10 and progress it to 15 repetitions in each side. The following exercise that I'm going to show you is going to be high plank, which is a core strength exercise for your lower back. You can start this exercise for holding in that high plank position within 10 to 15 seconds and progress it to 20 to 25 seconds. The next progression is going to be a dynamic high plank, which you create some sort of movements with your hands and with your legs, but you're maintaining a neutral spine in your lower back. This exercise can help you to increase your core stability, and you can try this in a daily basis for 3 to 4 times. We are going to move on to glute bridges exercise, which can help you to strengthen your gluteal muscle strength. You're going to lie down on your back and keep your arms next to your body, and with engaging your glute muscle, you can lift your hip off the ground. You can keep it at the top for a second for optimum results. If you find this exercise is easy, you can off your hands off the ground and hold them on your chest and practice this exercise for 3 sets of 8 to 12. You can progress this exercise to 15 repetitions and try this exercise for 3 to 4 rounds in a daily basis. We're going to move on to single leg hip stretch, which is a great exercise if you're suffering from spinal stenosis. Due to the nature of the injury that you have, you might have a lot of stiffness and discomfort around your gluteal muscle. This stretch can help you to open up your hip and help you to stretch those muscles. You're going to kneel down in a single leg, and with shifting your body forward, you can basically open up your hip. You can try this exercise for 3 sets of 15 to 20 second hold in each side. Practice this exercise on a daily basis for optimum results.
I would like to share with you 3 important tips if you're suffering from spinal stenosis. The first thing that you should follow is to get a right diagnosis with your physical therapist, which means if you're not sure that you have a spinal stenosis and you basically self-research in Google and YouTube and you find out, okay, these symptoms are similar to spinal stenosis, you might not necessarily have a spinal stenosis. Get the right diagnosis through your basically physical therapist. The second tips that I would like to share with you is if you're suffering from spinal stenosis, you need to minimize certain type of activity and movement. I would suggest my clients to avoid impact sports that you know that you're going to basically create a quick and high impact movement and twist in your lower back, and that would minimize your flares up and your pain and discomfort. At the same time, there's a specific movement that we suggest to avoid. It would be extension or hyperextension movement, such as cobra movement, for example. As a stretch, we don't want to create that extension or hyperextension for your lower back. Now, the last tips that I would like to share with you, that would be consistent with your rehab exercises, which means you cannot aim for a quick and fast results. You want to follow this exercise as part of your daily routine and help your body to actually adapt to these movements. And at the same time, you want to create that basically strength and maintain that strength through your lifestyle. I hope you guys find this video helpful. If you have any question about spinal stenosis, please leave me a comment underneath of this video and I would be happy to help you. Beside that, make sure to subscribe my channel for my weekly update and press that like button. If you like this video and leave me a comment underneath of this video, there is a chances of more people see this video on YouTube, and that would be a better chance for people who need help in regards to spinal stenosis or low back pains. I appreciate your help and I'm looking forward to see you guys in the following week. All the best.